Welcome to Mind Body Besties, your weekly reset with real talk, a little laughter, and the kind of honest conversations you'd have with your closest friend. I'm Katie, a therapist.
And I'm Rachel, a naturopathic doctor. We're here to share the personal stories, struggles, and wins that have shaped our own health and happiness. This isn't a lecture, it's a safe space to slow down, connect, and feel a little more human again. So grab your coffee, get cozy, and let's reset together. Thank you for joining us today. Today we have Dr. Emily Ray, and she is a doctor of Chinese medicine here in Northwest Arkansas. And so we're going to dive into some neat fertility topics and just learn more about Chinese medicine today. So, Dr. Emily, do you want to go ahead and just share with us a little bit about you and just a little bit about your practice?
Yeah, sure. My name is Dr. Emily is what people call me, or just Emily. And my clinic is called NWA Fertility, Acupuncture and Chinese Medicine. So it's in downtown Rogers. And I focus exclusively on people who are struggling to conceive, dealing with infertility, recurrent loss, or going through IVF. And my training is as a doctor of Chinese medicine, which means that I use a specific diagnostic framework where I'm able to help people understand not just maybe the diseases that they have, but the imbalances their body has, and then use tools like acupuncture, Chinese herbal medicine, lifestyle and dietary interventions, some supplementation to help correct those imbalances to improve fertility.
That's amazing. Well, let's go ahead and dive in. So do you want to share a little bit about how you got into this? Because not everyone ends up going down the more holistic alternative route.
Yeah, it's such a normal part of my life that I forget, like the general public is not involved in this yet. But the short answer is that this is what my mom does. I was trying to figure out what I wanted to do. Like towards the end of college, I changed my major a number of times because I have a lot of different interests. And my mom was listening to me talk one night and I was like, I want to do something related to health and wellness. And this is like back in 2009 before wellness was like a industry where that sells you supplements. It was like real wellness. And I was like, I want to incorporate psychology and spirituality and all of these things. And she just goes, yeah, you want to go to acupuncture school. And I was like, oh,
That's so funny.
okay, I guess I'll do that. And that's what I did. And I've been doing this for over 10 years now.
That's so cool. She's like, you want to do what I do.
Yeah, now that I'm so far into it, I can imagine her hearing me say that and be like, yeah, this is what you want to do. It's so clear looking back that it's a perfect combination of so many of my interests.
What got you interested in fertility specifically?
It was kind of a slow process and then happened all at once. A lot of it was the cases that I was treating, what caught my interest. And this is back in 2015, early in my career. I'm the type of person that if I'm not that interested in something, it's really hard for me to care.
Yeah.
But if I'm
same.
interested in it, I'm obsessed and I can't get enough and I can't learn enough. So part of it was just, this is what naturally drew my interest. And then I remember sitting in a class on the gut microbiome back in the day, and the lecturer put a picture on the screen of a woman who was pregnant with a female fetus. And it showed this woman, the baby in her belly, the fetus's eggs in her belly. And I was looking at, there's 3 generations inside of this woman's body. And I was like, oh my gosh, think of the ripple effect we can have in the world. If women are healthy, not just physically, but like emotionally, mentally, they know how to regulate their nervous system and communicate and all these things before they have kids, we're going to have healthier children, healthier society. So that got me even more excited when I kind of had that light bulb moment. And then it's just, I mean, I'm obsessed with the biology, even the science of IVF. And I really love the deep connection that I get with people when it's the hardest thing they've ever gone through.
Yeah. And you do, just based on my own experience, the people that end up really listening to you and helping you when you're going through fertility issues or IVF, you form a special bond with those people because they actually listen to you and really seem to care. And it is one of the hardest things to go through when all you want is to have a baby and you don't know if you can or how long it might take.
Your life feels like it's on hold and everybody else around you is just going on with theirs. And yeah, so helping somebody through what for them is the most difficult thing they've ever gone through is like, I like it.
Yeah.
Hey, did you,
I've had
the
that.
listeners know about your personal situation?
Yeah, yeah. So we did a whole episode on that, and I went through my whole story just like in the hopes that it would, one, be comforting to someone else if they were going through it, but also to tell them like what I ended up doing in case
Yeah.
that gave them some ideas for where to look.
Yeah, this is an option that you have.
That's really beautiful. I've had that same experience of looking at that diagram you're talking about and seeing the interconnectedness. And so that's really neat.
Yeah. Rachel, you practice fertility as well, right?
I do. Yeah.
Yeah.
And I've had that moment of like, I think women in general are the glue of a lot of communities and they hold and connect so many people, but that's such a direct physical connection. It's kind of neat to see that too.
Dude, it was just it was already, I was going in that direction just because of my natural interest. And then it was like a light bulb moment. And I was like, oh, I think I want to specialize in fertility. And I had some insecurity about it because I don't want children myself. And I was like, can I even do that?
I have felt the same way. Yeah.
Yeah. And I got together with a friend of mine who'd been a birth worker for like 30 years. And she goes, Emily, if a man can be a gynecologist, you can be a fertility acupuncturist.
That is such a good point. I've never actually even seen a female gynecologist. I feel like in our area, all of the gynecologists and all the OBs, they're all men.
That, again, is something that was different when I moved here. It's very old school, I guess.
Yeah.
And I'm from Phoenix, which is just such a big city. And it's just very different.
Yeah. No, but that's a really good point. If a male can be a gynecologist, then you can certainly work with fertility stuff, even if you don't want kids.
Yeah, I was like, okay, good point. I'm not going to worry about this. And people are surprised to hear that I don't want children when I do this work. But for me, it's not necessarily about the babies. It's about the journey and the experience and supporting people and being a little detective, trying to figure out what's going on and all that stuff.
So what are some of the most common things that you see like conventional medicine miss when it comes to infertility?
Yeah, there's sort of like the conventional medicine community at large, and there's more specifically in Arkansas.
Yeah.
So I'd say at large, male factor fertility problems are really big. I consider a thorough male evaluation to have 3 spheres and only one gets done, and that's the semen analysis. And you only have to meet a very minimal criteria in order for them to be like, oh, you're fine. There's no problem here. And I routinely will look at somebody's semen analysis and be like, I mean, it's okay, but I'm not wowed by this. Like,
Yeah.
it's passable at best. So male factor, understanding more subtleties in the menstrual cycle and the female body as a whole. So if you go to your medical doctor and let's say you have mid-cycle pain, spotting before your period, clots in your menstrual blood, very heavy bleeding or very painful bleeding, like there's no diagnosis for that. You might eventually maybe get a diagnosis of endometriosis after a very long process and many years of infertility, but they're like, I mean, that's normal. And in my world, we have very specific diagnoses for those types of things that we can fix. I would say male factor, the more subtle factors of the cycle that don't rise to the level of disease are really big ones. And then the whole life patient. I had somebody yesterday who is not having a period. That's a problem if you want to get pregnant. And then when you go through her history, her father died and that triggered an autoimmune disease that got a lot worse. And then her period stopped. And I'm like, okay, well, this resulted in infertility. It has a clear origin. And your medical doctor will just be like, well, you have to do IVF.
Yeah. They're not going to look at like a history of trauma and be like, oh, okay, this really traumatic experience then caused physical symptoms in the body. And me and Rachel talk about this all the time. Mental health, physical health, spiritual health are also interconnected. And if we could all work together and do what we're good at together, we'd get a lot farther with these kinds of things.
100%.
And so I noticed on your social media, you talk a lot about endometriosis. To me, at least, it seems like more women are getting diagnosed with that. Is that because we just didn't know what it was before and we're getting better at finding it? Or is it that more women are developing it? What's the deal with endometriosis?
I don't necessarily think more women are developing it. That's possible, but I'm not sure. I think there's a better understanding of how it presents. And it's
Okay.
not just painful periods, it's GI issues like constipation or alternating constipation or diarrhea. Sometimes the GI issues are the only symptom that somebody has. And so you go to your doctor, you go to your GI specialist, there's nothing wrong with you. And especially like a GI doctor, they're not thinking about the reproductive system at
Sure.
all. So I think there's more understanding of how it presents and how it might present differently in different people. And sometimes the only symptom is infertility. There are no other symptoms. So I think it's just a matter of like better understanding and better treatments. Like we have endometriosis specialists who are surgeons, and then we have a better understanding of how to use medication to treat endometriosis to improve fertility, things like Lupron treatment. So I think it's just a better understanding of the condition.
It makes a lot of sense. So this might be a good time to dive into, from your perspective, how do you think acupuncture helps fertility? What's going on? How do you explain it to your patients?
Yeah. What do you do?
Yes. Yeah, that's a great question. Sometimes I'm like, I don't know. I get acupuncture myself, and I'm still to this day, I'm like, wow, this stuff really works. I really separate the modality of acupuncture from the body of medicine of Chinese medicine, because acupuncture is a part of Chinese medicine, but it is not all of Chinese medicine. So, for speaking of acupuncture specifically, this is the tool I use to support people going through IVF treatment. We tend to not use the whole body of Chinese medicine because they're taking medication and their medical doctors managing their care. So when it comes to those people, I say we're using acupuncture to support your treatment. The way it works primarily is by modulating the autonomic nervous system. I can say that to you guys because you understand what that means. When I talk to patients about it, I say your autonomic nervous system is your brain and your spinal cord and all your nerves. It's called autonomic because it's in charge of all of the automated processes in your body. Breathing, digestion, reproduction is one of those. And it's got two operating modes. One is called sympathetic or fight or flight. The other is called parasympathetic or rest and digest. And you can't be in both at the same time. It's one or the other. And acupuncture interfaces directly with your nervous system because your nervous system is like a circuit board, and we're sticking a piece of metal into a circuit, an electrical field, a bioelectric field. So there's going to be an effect on that circuit board or that bioelectric field. And we're able to help the body shift into this more relaxed state, which has the natural effect of improving circulation to the reproductive organs, improving communication between the brain and the ovaries. I think a lot of people don't necessarily understand when the effect of improved circulation. That's better nutrients, better oxygenation, all these positive effects that come from that. And it's simply from this autonomic nervous system, like modulation. I think that's the primary way it works. That's just my theory. But you can tell, Rachel, I don't know if you do acupuncture on people, but when you are putting needles in, like as I go around the body, the patient starts to talk slower. Their body gets heavier. They're like thinking. You can see it. And then they start to like not think. They're just like, okay, I'm ready. Please leave.
Yeah. Almost every time that I got acupuncture, and I went, I think, twice a week for, I don't know, maybe 2 weeks, and then once a week for several months. And almost every single time I would just fall asleep. After all the needles were put in, I'd get an eye pillow, a nice little weighted eye pillow on my eyes, and there was some meditation music, and I just passed out almost every time.
I'm not sure. Like, I just had acupuncture on Friday, and I know what you mean. I'm not totally sure that people are really asleep. I think they're in this in between sleep and awake state that sometimes researchers will call non-sleep deep rest now. It's like basically like a deep meditative state. It's highly restorative to the body.
Yeah, I would always feel really, really good. Sure.
Oh man, so good.
And it's so funny because I was so nervous to try it because I mean, you're getting needles stuck in you. And
Yeah.
then after that first session, I was like, no, I'm cool with it. They can put as many
Yeah.
needles in me as they want.
Yeah,
I
it's
also
very
love it.
common. Yeah. So you get acupuncture?
Oh yeah, I get acupuncture and I'm one of those weird people that can feel all the little energetic shifts. Like put a
Mhm.
needle somewhere up in my wrist and like my foot starts twitching, like my fascia just responds so much.
Those are the best people. I love it. People describe them as sensitive, and I'm like, that is a great thing because it doesn't take a lot to have a big effect on the body.
That has been the story of my life. Yeah, my body is
Yeah.
so sensitive.
Yeah. I mean, it's like good and bad, but from like my
Yeah.
perspective, I'm like, it doesn't take much to have a really big shift in like actually the physiology. of the
Yeah,
body.
for sure. Well, and I heard you mention earlier that you like to encompass spirituality and emotional health and all of this into what you do too. How do you picture spirituality and emotions and everything tying into what you're doing?
Yeah, Chinese medicine is like my native language, and those things are just part of the philosophy. So when we talk about spirituality from a Chinese medicine perspective, it's really about connection to something greater than yourself. In my world, that means nature. So one of the ways to access health and restore health in Chinese medicine is living in alignment with the seasons, with the natural rhythms of life, and having a relationship with nature, the way that some people might talk about a relationship with a higher power. But I sort of translate that into spirituality as a connection to something greater than yourself. It could be your community, it could be a religious faith, it could be something else that makes you feel less alone in the world. So that's kind of the spiritual component in Chinese medicine and sort of Taoist philosophy. That is nature.
Yeah.
And then the emotional stuff. So we have different causes of disease in Chinese medicine. They can be internal, they can be external. But one of the major ones is something we call the 7 affects. And that is 7 specific emotions that cause disease or dysfunction in the body.
Ooh,
And
interesting.
sometimes
Okay,
that's
what
the
are
only
those?
cause of disease. Okay. Oh my gosh. You're putting
I
me
know
on
too a
the
little on
seven.
the spot.
You can look it up if you need to.
No, it's fine. Okay. So anger, let me write out the 5 elements so I can fire earth, metal, water, wood. So anger, worry, and worry and pensiveness are actually 2 separate emotions, which I find very fascinating. Worry is like future focused, and pensiveness is like you're stuck in this present thought spiral.
Okay.
So anger, worry, pensiveness, grief, joy, and then fear or shock. The shock is like the word we have for trauma. So is that 7? I don't know. Those are the ones
Wow,
that
why is joy on the list? That's
Yeah.
shocking.
Oh, because one of the tenets of Chinese medicine philosophy is that anything in excess becomes its opposite. So joy at excess becomes mania, restlessness, instability, or anxiety, like a physical experience of anxiety. You can't settle in your body.
Wow.
That actually, okay, that makes a lot of sense. Like,
Yeah.
like overabundance of joy translating to mania in my therapist's mind, that like makes
Yeah.
a lot of sense to me. Okay.
Yeah.
Very
And we
cool.
might think of it nowadays as like toxic positivity, like emotional bypassing. We would call it emotional stagnation in Chinese medicine. And that has a physical effect on the body, especially on the menstrual cycle, which is really interesting.
Wait, can you
For
dive into
females.
that a little more?
Yeah. Yes. Okay. Chinese medicine 101. We have organs in Chinese medicine that when we say an organ name, it's partially a metaphor, it's partially referencing that specific organ, and it's partially describing a group of functions in the body that are associated with each other. So the organ that I'm going to talk about is the liver. And that doesn't necessarily mean your anatomical liver. Like I said, it's a metaphor. It's a description of functions of the body that we don't have language for in Western medicine. So your liver is responsible for ensuring the smooth flow of three things: blood, body fluids, and emotion. Part of that function is ensuring that the body transitions between different phases of the menstrual cycle smoothly. That's a smooth flow of energy through the body, what we might call chi. So if there's any symptom that arises at a specific phase of the cycle, that is a symptom of liver chi stagnation. And if you think about the other functions of the liver being ensuring the smooth flow of emotions, emotional stagnation, lack of emotional processing in the physical body is going to stagnate that liver chi and give rise to cycle specific symptoms. The hallmark sign of that is breast tenderness before the period.
That's so interesting. Okay, so if you're like, oh, everything's fine, and you're not letting yourself really feel and process the emotion, and you're not tuning into your body, that would be stagnating your liver chi, and then that could affect your
Yes.
menstrual cycle.
Yes, exactly.
All of this stuff is so interesting to me. I could just listen and ask questions forever.
I'm like, go to Chinese medicine school.
I know,
So
right?
fun.
I thought
That's
about it
my
so
next
much.
career.
Yeah.
Yeah, Rachel, you went to
I went to NUNM, so they
Portland?
have, yeah, in Portland, so like big Chinese medicine school there in
Yeah.
the school with the naturopathic school. And so a lot of people do a dual degree, but
Okay.
then I would have had to be in grad school for 6 years instead of 4.
That's
And I was like,
so
I feel
long.
like, yeah, the 4 was
That's a lot
enough
of
by
school.
itself.
Yeah, that's common in Phoenix too. People go to naturopathic school at whatever. the
Oh
school
yeah,
there, and then
Sonora, and they get their a
yeah,
little bit of
and then
acupuncture.
and then they do like an extra year at the acupuncture school or something like that. My mom taught at the acupuncture school in Phoenix for a while.
That's cool. Yeah, if I'd gone to the Arizona school, I definitely would have dived more into acupuncture because Chinese medicine just makes everything make sense. Like the dampness and all of that, it just all ties in with the seasons and everything.
Yeah. I mean, it was developed purely based off of observation of humans and how they interact with the environment and how illness presents in the body. So it's very intuitive because it's just based off of like observing people over thousands of years. And no, like they did not have social media. They didn't have the internet. They didn't have a
Right.
lot to do. So they just observed.
It's amazing.
So,
Yeah.
what do you do with other patients that aren't going through IVF? In addition to acupuncture, what else do you do to help support them?
Yeah, so a lot of the magic is in the assessment. So this is what people are not getting from their medical doctor here. No
Yeah.
shade again on their doctor. But because we have this way of looking at these like subtle imbalances in the body and how they all connect together, I think the success I have is because I'm able to do a thorough assessment of both partners, see where there's opportunities for improving health in both partners. We know that improving areas of health that might not seem related to fertility, like digestion and sleep and stress, improve fertility. But that's what I do. I'm like, okay, let's do a full body assessment of both partners. Let's identify opportunities for improvement in health, in the menstrual cycle, in the GI system, in sleep, and whatever lifestyle. Let's look at information we might need that we don't have. So that would be through blood work or imaging studies. I have to practice more Western medicine than I would like to because nobody's doing it,
Yeah.
unfortunately. So I'm like, okay, these are tests that could be helpful for us to understand what's going on and what the best recommendations could be. And then we use acupuncture and Chinese herbal medicine mostly to treat the imbalances that I find. So that's what we're doing with people. I call it holistic fertility. I have like literally 2 different services, IVS acupuncture and holistic fertility. And so that's what we're doing with holistic fertility people. We're looking at what are the opportunities for improving fertility in both partners, both things that rise to the level of a disease in Western medicine and the more like imbalanced type that if you go to your doctor, they're not going to find a disease, something wrong with you. What information do we need that we don't have? And then what are the specific actions that both of you can take so you know that you're improving fertility? A lot of that, one of the things I have pretty much everybody do is track their basal body temperature. So we could see the improvements in the basal body temperature from the things that we're doing. Does that answer your question?
Yeah, yeah. And I got super into tracking my basal body temperature, and I still do it now because I just think it's interesting and I like to
Dude,
make
it's
sure that like
crazy what you
the
can learn.
curve looks right.
Yes.
And yeah, the information you can get from that alone is
Dude,
like, am I ovulating? And no one ever teaches you that. You don't learn that in school.
I'm a big fan of sex education. It's part of our body. It's very important.
yeah, that's the thing. It's not necessarily just about sex. It's about understanding how your body functions so you can advocate for yourself if you need
Yeah.
to.
1000%. Well, what is, if you don't mind sharing, what's something that you've seen? Maybe it can be a story or just something in general. Is there something that you've seen with male fertility or come up in a couple together? Like anything that you can think of for what someone would be surprised to hear that affected their fertility?
For men specifically, I do a full history for the man. I think they're surprised that they even have to like talk to me at all about anything. I ask about the things that we know could potentially have a harmful effect on male fertility. So those are heat, the testicles being exposed to heat. So that's hot tubs, saunas, hot baths. I'm concerned, but I don't fully understand how the mountain biking gear might impact male fertility. It's on my radar, but we just don't have
Yeah.
a lot of information about that. So sources of heat and then harmful substances. So that's cigarettes, tobacco, alcohol, nicotine, cannabis, and testosterone. I think people are surprised to know that alcohol, like the recommendation for male fertility is to drink less than 2 alcoholic drinks per week. And sometimes I say that to people and they're just like, that's like not a lot of alcohol. And I'm like, yeah, well,
It affects what you need to work.
yeah, it is surprising to me that people don't know that alcohol has an effect on their fertility. The recommendation for women is less than 1 drink per week. And there's certain conditions and certain types of people, if they're prone to what we call heat in Chinese medicine or inflammation, I would recommend no alcohol for an extended period of time. I'm talking 6 months. So alcohol for sure. What are things that people are surprised to know affect their fertility? I'm always surprised when people are surprised that their lifestyle affects their fertility.
Yeah.
Yeah. And
Fair.
we've talked about cutting out just environmental toxins and fragrance from your home, get rid of the Bath and Body Works candles because people don't understand that that affects your health.
Yes. Sleep is another big one. Women who sleep 8 to 9 hours a night have better egg quality and even higher ovarian reserve. And so that is a really big one that I focus on. Sleep impacts male fertility. I hope everybody knows that men should not take testosterone if they intend to have children. Do
Yeah.
people know that?
I don't think people
Probably
do know
not.
that. Yeah.
Oh, okay. Then that's a big one. Do not take testosterone. I wouldn't even, if you have any plans for future fertility, I would recommend against taking testosterone because there are things you could do. So if people don't know, taking testosterone, even if it's hormone replacement therapy, it down regulates your natural production of testosterone and it frequently leads to zero sperm.
Oh, wow.
Zero. And there are medications you could take, like HCG, to potentially mitigate that effect. But in some men, that effect is permanent. They are sterile from that.
Oh.
Yeah. And
And I don't think they're told that.
No, I doubt it. And I would have never thought that it could potentially make them sterile. And I think like
Yes.
most men are like, yeah, more testosterone, more manly. And it's like, you're not going to be so manly if you have zero sperm at the
Yeah,
end
it
of
has
this.
the opposite effect. And I've seen men who have been put on testosterone in their early 20s and become dependent on it. I had a case earlier this year or last year where he had been put on testosterone at the age of 22 because of, hormone replacement therapy. I'm saying air quotes because like his testosterone was probably like 300. He probably did not need that. He probably just needed to sleep more. And by the time they were ready to try and conceive, when he was 30, he was dependent on that testosterone and had no sperm, and that was not correctable.
Oh my gosh.
that's really sad.
That is, yeah.
Yeah.
And to
Informed
not-
consent, like at least tell someone what the true risks are.
And that doesn't happen often. A lot of times it's correctable with taking Clomid, which you have to take for 3 to 6 months to restore normal sperm levels. But I even like 6 months is a long time to wait when you're ready to have a baby.
Yeah, it does feel like a really long time.
Yeah, I've had the hardest time finding providers to refer men to who will prescribe Clomid or clomiphene for men or anastrozole or do any of the other things that would help boost their testosterone without actually taking testosterone.
I
Yeah.
didn't even know men could take Clomid because I've only ever heard of women taking it when they're having fertility
Yeah.
problems.
It works the same in both men and women. It basically tricks your brain into producing more gonadotropins, develop estrogen or develop testosterone. Gonadotropins are like FSH and LH.
Okay. Yeah. No, I would have never known that. Okay, I do have a random question because I think this is interesting with acupuncture. Do you look at people's tongues?
Yeah, my phone is just filled with pictures of people's tongue.
It's just tongue pics.
Yes. Like if anybody ever sees it, I was like, I wonder what they think. Like, why all these tongue photos?
Okay, so when you're looking at people's tongues, what are you looking for? What does it tell you?
Yeah. The theory. So, like I said, Chinese medicine was developed thousands of years ago before doctors had blood work. There was no x-ray, there was no MRI. So we needed to develop a system of understanding what's going on inside the body. And your tongue is the only organ that you can see. So that's why it's so valuable to look at the tongue. So we look at the color of the tongue body. So it should be pink, but it can range from very, very pale to very deep purple and sometimes even black, but it should be pink. So the color of the tongue body, the shape and size of the tongue. So is it swollen and too big to fit in the mouth and it has these teeth marks on the side? Or is it teeny tiny? Like you're like, oh, the tongue doesn't match the person's body size. So the shape and size of the tongue, if there's any markings on it, like cracks or things like that, and then the color and thickness of the tongue coating. So a normal, healthy tongue should be a pink tongue body. It should have a thin white coating that's uniform over the full tongue. So it's not thicker in the back or missing on the edges. And there should be no cracks on it. It shouldn't look dry. It shouldn't have these inflamed ridges that my tongue and a lot of people's tongue have, which is a hallmark sign of liver qi stagnation. It shouldn't be more red on the tip, which is a sign of heart fire or like anxiety. And then I look at the veins under the tongue, which tell us basically like proper blood flow and if there's accumulation of blood in the abdomen or the lower abdomen, which we call blood stasis. So the veins under your tongue should not be visible for the most part. And they can become distended, sometimes quite distended. And that tells us if there's blood stagnation in different parts of the body. So the color of the tongue, the shape and size of the tongue body, if there's any markings or cracks, and then the thickness and color of the tongue coating are the things we look at. Every single person's tongue looks different.
Does it gross you out at all to just look at people's tongues?
Not anymore. It's more like, wow, like if I see a gnar like this woman, I think I made her feel bad, but I was like, oh, I remember that tongue. Because it was just so, it was deep red with all of these deep cracks. And I was like, oh yeah, I can't forget that tongue. No, I mean, it's just more interesting to me.
There's so much cool stuff with Chinese medicine. If we're going to wrap up, what is something that you wish everyone knew or just something that you'd like to share?
Yeah, I wish everybody, especially here in Northwest Arkansas and Arkansas in general, knew what a proper initial fertility workup looked like. So they're trying to conceive for a few months, nothing's happening, maybe a year, they go to their doctor, they know what testing should be done. The aspects of a proper fertility workup are blood work done on day 3 of your menstrual cycle. So the first day of your period is day 1. So 2 days later on day 3, that includes FSH, LH, and estradiol. So 2 hormones that come from your brain and 1 that comes from your ovaries. So that tells us how your brain and your ovaries are communicating and if your ovaries are responding to that messaging from the brain. Sometimes I include a marker called AMH in that, but only if it's going to be relevant. So that might help us decide if someone's like, should I do IVF? Should I not do IVF? I might include that. And that tells us their ovarian reserve. It does not tell us their ability to get pregnant naturally, but it might help us understand how they could respond to IVF. So those day 3 labs, FSH, LH, and estradiol, an imaging study called an HSG, a hysterosalpingogram. And this is an X-ray study that tells us if their fallopian tubes are open. That is very important.
Yep, I had one of those done.
Yes, and people will be afraid because it can be uncomfortable. There's strategies to help mitigate that discomfort. If you go with a full bladder, that's one of them. And if you take ibuprofen and Tylenol before, that can be helpful. Honestly, the skill of the person doing it has a lot to do with it, how gently or quickly they push the dye.
Mm-hmm.
So that HSG study, I personally also like a uterine cavity evaluation. So this would be something called a saline bubble study or an SIS. That's not a standard part of the workup, but I think it's very important because it's crazy that such a look at your uterus. So you could have polyps or fibroids or scar tissue, especially if you've had prior pelvic surgery, like a C-section, that could interfere with your fertility. So the day 3 labs, checking if your tubes are open, looking at the uterine cavity, and then doing the semen analysis. So that is a male evaluation where they take the semen, look at it under a microscope to tell us how many sperm there are, if they're moving in a way that would allow them to reach an egg, navigate the reproductive system, and then what is the shape of those sperm. So that is what a full fertility workup looks like. That is not what I would call a full body fertility evaluation. That would be more thorough, but that would be the minimum you would need to have a proper fertility workup.
And another thing, I'm curious what you think about this. So after I had my first miscarriage, it was kind of like, okay, this is common. It happens sometimes. I'll try again. And I was fine with that. After the second one, I was like, okay, I feel like something is wrong. And I was told you have to have 3 miscarriages before it's considered recurrent loss. And they didn't say it this way, but it was basically like, if you want us to do something, this has to happen 3 times. And then we'll start looking.
Yeah, that's completely up to the discretion of the provider. There's no law that says that. There's a potential that maybe your insurance won't cover the test, but that would be something you would just tell the patient. Most people do not want to wait for 3 losses. But I just had somebody yesterday. She had, I can't remember if it was 2 or 3 chemical pregnancies over the summer. And so we're like, yeah, we're going to do something about this. We're not going to let this keep going on. And she had a uterine cavity evaluation called a hysteroscopy last week, where they put a camera actually into your uterus, and she had polyps is the technical word, but she had just chunks of tissue in her uterus where an embryo would implant. And it's of course, you're not going to have implantation and a continued pregnancy when there's a physical thing blocking it. But if she hadn't had that, they would have just been like, oh yeah, just keep going. Maybe she wouldn't have had a successful IVF cycle with that. So yes, you're right. One can happen. One is horrible. It doesn't necessarily raise a red flag that something is wrong.
Nope.
2, that's where I'm like, okay, we're not going to.
Because
not
at
do
first,
anything.
they were like, well, it could have been a genetic thing. This happens. And I'm like, okay, sure. But then it's like, okay, well, that didn't happen 3 times in a row.
No, yeah. And even after 1, there's simple tests that blood work that can be done to look at your thyroid, autoimmune markers, blood clotting factors, things like that. It is totally up to the discretion of the provider whether or not they want to look into that. And that includes doing a proactive fertility evaluation. Some doctors will be like, well, you have to try for a year before we do any tests. That is not the law. You can go to our fertility clinic here in Rogers, not mine, but the IVF clinic, and they will do an evaluation on you at any time. You don't have to wait for a year. Yeah, especially if you know something's wrong, if you're having irregular cycles or multiple early losses, don't wait.
Yeah.
And if your doctor doesn't want to do anything, then unfortunately, you have to go to a new doctor. It's
Find
really
another
annoying.
doctor.
Yeah, it's easy to say, really frustrating to have to do.
Rachel, do you have any other questions?
No, this was amazing. I think all my questions are answered already.
So if anyone who's listening is having fertility issues or knows someone who is, there are lots of other options out there for you and lots of different kinds of providers that can get you more
Yes.
information.
Yeah, absolutely. A fertility acupuncturist, a naturopathic physician who specializes in fertility. We have great pelvic floor physical therapists here in Northwest Arkansas, some that
Yeah.
have expertise in fertility. Yes, I honestly think having a physician who maybe doesn't know everything, but will listen to you. And if you come to them with tests that you're interested in, will run those tests is really valuable. They don't necessarily have to be an expert because we don't have that, but they have to be open to learning with you and not stopping and trying to figure out what's going on is really valuable.
What's the best way for someone to contact you if they want to get in touch?
Yeah, so they can follow me on Instagram at NWA Fertility. They can email me at emily@nwafertility.com. And then I do have a podcast that's going to come out next year where we'll be
Awesome.
talking about specifically the experience of dealing with infertility or fertility issues in Arkansas. That's like what I'm really focused on is it's a unique experience we have here because of lack of access to resources and specialists and specialty care. And it's so much harder to decide what to do when like you're like, do I go to Dallas? Do I go to St. Louis?
Mhm.
It adds just a whole nother element. So that's what the podcast is going to be about. And that will be out like in the spring of next year.
Awesome. That's so exciting.
We'll have to
Yes.
look out for that. That sounds great.
Yeah.
Yeah,
Well,
you guys are inspiring me. I already have the first few episodes outlined and now I'm like, okay, I feel inspired.
nice. Yeah, just you put it out there and someone who needs to hear it will hear it. But okay, so we'll put all of your contact information in the show
So my
notes
website
below.
too, it's just nwafertility.com.
Okay, perfect. We'll put all of that below. So if anyone in the area wants to get in touch, you guys will be able to do that. So thanks so much, everyone, for listening. I hope that you got something out of this or send this to someone who might need this information. And we'll catch you guys in the next episode.
Bye, everyone. Thanks for joining us for another weekly reset. If you loved hanging out with us today, subscribe so you never miss an episode, and share this with a friend who could use a little calm and connection too.
This show is for education and inspiration, not medical advice. To learn more or connect with us, check out the show notes below. Until next time, take care of your mind, your body, and your heart.